Hi, everybody. Members of the public wishing to participate in the meeting must use their full names for Zoom access. If full names are not used, people will not be allowed to participate in the discussion. The town reserves the right to remove any member of the public from the meeting who does not use a full name or acts inappropriately. As a preliminary matter, this is Athlyn Sweeney, the chair of the CHS. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Tara?
Here.
Suzanne?
Here.
Sue?
Here.
Veronica?
Here.
Staff, when I call your name, please respond in the affirmative. Jericho?
In attendance?
And anticipated speakers are members of the public. Tracy?
Yes, here. Tracy
Thank
Nickel.
you. And I'm just going to cue my recording to make this simpler. On July 16th, 2022, Governor Baker signed into law an act relative to extending certain state of emergency accommodations, which among other things extends the expiration of the provisions pertaining to the open meeting law to March 31st, 2023. Specifically, extension allows public bodies to continue holding meetings remotely without a quorum of the public body physically present at the meeting location and to provide adequate alternative access to remote meetings. That does not make any new changes to open meeting law other than extending the expiration of the temporary provisions regarding remote meetings. And just for sake of updating it, as you said, we're going, that provision covers us until May 2025, correct, Jericho?
I believe so.
Okay.
Additionally, there was an updated script that was shared around not too long ago. I want to say about 2 weeks. So I think that one also, which have the updated finish date.
Okay, and I do not have that one yet, I don't think, or at least I did not see it. So I will look for that following the meeting and get that update for next time, for next month. And just for sake of getting Amanda into the meeting, Amanda, right, can you just hear and see me? Just unmute yourself.
I can hear and see you.
Very good. I'm glad you were able to join. Okay, so the first item on the agenda is contract review representative discussion. And I know Veronica and Jericho and myself have been working on this, but I believe Veronica, you have the most updated information. Would you like to share?
Okay, well, this actually I got from Jericho this afternoon, and I know that Sue, you had expressed interest, Minthinen, and you would be able to participate as number one, we know that you are a registered voter on the island. Number two, the only thing you would need to do is you would need to recuse yourself with any discussions that would have to do with an employer. And also any grant writing or correspondence with the employer. So otherwise you are free and clear to join. And I know that you've been participating as a member of the public in the last couple of weeks. So we are in full throes of another project, and we need another person. So if you are willing, arms are open.
Sue, are you open to that?
Well, I want to know why Jericho's hand is raised and what he has to say.
Thank you very much.
I didn't see it.
It's just specifically the specific verbiage that was used about your participation in the grant writing process for Fairwinds is that you cannot sign or be an official representative on the grant writing thing. So I just wanted to make sure that just get that very clear.
Thank you, Jericho.
And then
Wait, Amanda, would you like to?
And I mean, Sue's gonna do an internship at Fairwinds next fall. That has nothing to do with this, right?
The only reason this was a concern was that she might be starting to work or be professionally associated with with Fairwinds if it goes for funding through CRC. I spoke with Maureen Coleman. It was a pretty open and shut the discussion where she was like, full participation acceptable. She must recuse herself from the deliberations on Fairwinds funding. And then she cannot. Initially, it was participate in the grant writing process, but more specifically, you can't be the contact point or a signature on that.
Okay. Jericho, if her relationship, and if I'm reading this properly, I'm sorry, is not going to start until the fall, would that apply immediately?
I don't believe it will start until the beginning of her work.
Okay.
So I think from your start date. So I don't know exactly what the youth behavioral health grant structure is going to be in terms of the writing of the grants. So there may be a direct grant from Fairwinds as part of this fund. In that case, Sue would not have started working there and still would be fine. So I don't believe there'll be any conflict even once you start working at Fairwinds.
So Sue, after everything you've heard, are you still on board to?
So
Yeah,
I'm
that's
still
it.
interested. I absolutely would defer to anyone who is less intricately involved in so many organizations.
Is there anybody else on our committee who has interest?
I don't understand what you're asking about.
So the contract review committee is a committee that works on town, a lot of the nonprofits who apply for certain monies through the town. And so it's going over all of the proposals, working with the committee to decide how to disseminate and who to give money to, and sometimes who to not give money to, but maybe help to get to other resources. So it's a second person to sit on the contract review committee.
Right. And if I can add, I've been on the committee since last fall, and we just went through the grant cycle, but meeting throughout the year and just undertaking potential for another huge project that we've been meeting with all sorts of folks. So the commitment is, I'm going to assume for most of the year, it's at least once a week and sometimes more than one meeting a week. You can participate by Zoom if you can't make it in person. They are hybrid meetings, but it is a commitment that goes all year long, and it's rewarding, but it's a commitment of time. And that's just one thing I want to say, that we need all in, and that's why we need more people. We need to be up to full speed. And right now we've been short. So,
Yes. And I'd also like to say we're under pressure, I think, to make this decision on this meeting today, because it's been a little bit of time since we have had somebody missing.
It's not anything I can commit to right now. I'm sorry.
Okay. And so is there anybody who'd like to make a motion that Sue Mitchell sit on the CRC and be our second representative on the CRC committee?
I'd like to make the motion.
Veronica, thank
I'll
you.
second.
And that's Tara second. Great. And then I will do a vote by roll call. Tara,
Aye.
Suzanne,
Aye.
Amanda,
Aye.
Veronica, and Sue.
Should I abstain?
You vote
This is
for
weird.
yourself. So
Yes,
it's a
please.
unanimous vote, and Sue Mitchell is appointed to the CRC committee.
I can
Thank
say,
you.
as long as Amanda nods that she thinks it's okay.
Okay.
I just worry about how you're gonna do it all, but you have to figure that out. So.
Okay. And our meeting is 2:00 on Monday coming. So we will make sure that you get the invite for that.
And
So
I
might be-
bel-
it's
I
on my phone.
believe there's a swearing in process that might have to happen before that before you can officially vote. I can't remember if you're
Uh,
automatically, did you not swear in for that particular one?
No, I didn't.
Okay.
I swore in for Council for Human Services, but not individually for this.
Great. Thank you. And Sue, thank you for stepping up. We really appreciate it.
Sure.
Okay, moving to the next item. Amanda, I was wondering, and we had been talking about you doing an update for the new services that Fairwinds has to offer. And just for a reminder, just remember to mute your computer or phone.
So in terms of the Community Behavioral Health Center?
Yep.
Yes, so Fairwinds applied for the Community Behavioral Health Center. The beginning of probably about a year ago, that was through the state, and the state basically made the decision that whichever CBHC in the catchment area was granted, then they're responsible for crisis and for being able to provide more services to the island. And so Fairwinds applied. It was a lengthy application, and we successfully were granted it. And we had about 3 months to get it up and running to launch January 3rd. And so basically what it means is that, you know, obviously we're the main mental health agency on the island, and we provide 11 lines of service, but we also added a crisis. So what that means is that we respond anywhere in the community, to people's homes, to the police station, to Cumberland Farms. For anyone that's in crisis that needs support, we will respond and do an evaluation, and then evaluate what level of care the client needs, and then provide ongoing services. So that means that the agency, we're now open 8 to 7 Monday to Friday. We're we're gonna be open more on the weekends at some point once we get staffing. But we are the main crisis responders. We have a relationship with the hospital. And so what that means is that they have contracted with us to do crisis in the emergency room. So any client that presents that may be expressing suicide ideation, homicide ideation, needs detox, they will call us, and then we go in and do an evaluation, determine level of care. If they need a higher level of care like inpatient psych, we will get them to inpatient psych. We do follow-ups. So what that means is for children, we're supposed to follow up with them for 7 days after we do the evaluation. So that's checking with the parents, checking with the child, seeing how they're doing. Did they follow up for their, their services we set them up with? For adults, it's 3 days. We now have 5 psych providers. So we are able to get someone a med managed appointment right away. And give you a good example, we had a woman who was expressing SI to her peer recovery coach. She texted me. I went in and met with her. I did a crisis eval. I was able to get her a med appointment within an hour. We set her up with a same day counseling appointment and then therapy with her clinician the next day. And like that.
Amanda?
Yep.
Oh, sorry. Can I just have you slow down about one thing? Because I'm thinking if any community members watch this, I just want to make sure it's clear. When you say that once you evaluate if the outcome is that somebody needs a psychiatric hospitalization, what does that look like? Can you say a little bit about what that is? I don't think the layperson always knows what that is.
So if there's someone that is expressing thoughts of killing themselves or killing someone else, they're presenting as psychotic, acting irrationally or erratic. There's 2 things we can do. Like we can go and evaluate them, and then we can do a section 12, which means that this person at this point does not have capacity and needs to be sectioned in order to go to the hospital to be properly evaluated. And that's basically against their will because we're worried about their safety to themselves or others. And then either I can do a section and then work with the police to come and get them or an ambulance, or we can sometimes work with the parent to bring the child in, and then they go to the hospital and we evaluate them there and determine the level of care.
And how long might they sit here in the hospital sometimes before they go off to the hospital?
I have great news about that. General Brigham has a bed placement team now. So basically we do the evaluation, we put in a bed order through their computer system, and then there's a bed team that finds a bed. So I can give you an example. We had a gentleman last night. We were called at 12:30 in the morning by the police. We did an evaluation at the hospital at 2 in the morning, and he is leaving the island at 5:30 to go to inpatient psych.
That's fantastic. That's a big change in the system for Nantucket. So I think that's really important for everybody to be aware of, the community. I see you, Sif. I won't miss you. Everybody to be aware of that is a huge change for the community of Nantucket, because historically, sometimes people would stay here in the hospital for 5 days trying to find a bed off island. So that is a great closure in the system for mental health. Sue, go ahead.
I just so happen to be doing a project that involves CBHCs right now. And I'm of course using Nantucket as a little bit of a case study in my presentation. And I'm wondering if we've been able, or Fairwinds has been able to establish the community crisis stabilization. As Fairwinds have a site where they can do sort of that temporary non-inpatient placement.
Yeah, so unfortunately, given that we're 30 miles out to sea, there are no crisis stabilization units on the island, but we, Jason and I went and did a road trip in the fall and met with various people from different organizations to introduce ourselves and say that we're going to be the CBHC. So we have partnerships where we can reach out to them and get someone to a crisis stabilization unit, or and we've had success in able to get someone like within the next day. We also have support around transportation. So if they are struggling with paying for the ferry, or getting from somewhere because it's voluntary, or getting somewhere from like Hyannis to the facility, we can Uber them. It's the same thing with detox. We don't have a detox on the island, but if someone's interested, and we've had individuals where we literally have been able to drive them to the ferry, get them on the ferry, get an Uber to pick them up, and then take them to the detox facility. And we'll even pick them up afterwards and bring them back to the island. So it's really full service care. Our response time is 15 minutes. So like we're at the hospital if they're there, we're, at someone's home if they're, within 15 minutes, or we meet them at the agency. And our goal really is to provide as many services as possible so people don't have to go off island. Going to the hospital is scary for anyone, especially if you've been sent off island in the past regarding mental health issues. So if we can come up with a safety plan and enough services to keep that person safe at home, then we will do that. And we've had success.
And so it sounds like, Amanda, what you're saying is your response time is 15 minutes. So if it's an emergency, like 911, that's what they need to call, right?
Yeah,
You
if it's
can't
an-
wait.
Yeah, and then, like I said, we have partnerships with the police and fire department. I meet with them monthly now. They've been amazing. A lot of referrals are coming from the police. So for instance, the police called us last night. They've called me to go see an individual at the police station. So we're all working really closely together, but obviously it's an emergency 911. But if not, if you have an adult child that's struggling and you're worried, obviously that's stressful for you. You can call the 508-221-3315. That number is covered 24/7, and we're available to meet you wherever you're at. And the goal is to get you connected to services. And then, if you need bed management, we can get you in the next morning, starting at 7:30. So we're trying to provide as much access of care to everybody.
Wonderful. And an individual can also just refer themselves. It doesn't have to be someone on someone's behalf. An individual can call and say, I don't feel safe, right?
Yeah, and you can even call if you're concerned about a friend and the community, and we can kind of brainstorm in terms of how best to get that person care. So
Great.
just reach out to us and we will help you. And we're available 24/7.
Wonderful. And can you also say some information about the Family Resource Center and UBHC?
Yes. So in addition to the, we also applied for the Family Resource Center and were granted that. Christy Wilson's really spearheading that for the agency and doing a great job. She's hired multiple staff members and is still hiring. And it's a wonderful relationship in the sense that what Family Resource Center, the services they offer are very different than Fairwinds. And so we kind of work as a team, and we can refer clients there. And, they call themselves the Family Resource Center, but basically you can be an adult, single, needing help, and you can go there and they will connect you with whatever services that you need. So it's a great resource, and we kind of work together. And if a family went there and were concerned about one of their kids or their loved ones, they can make a referral to Fairwinds for therapy, med management. So it's a good collaboration. And then in terms of the urgent behavioral health care, UBHC is what we call. And so that is a same day free appointment. And so what this means is you could call and, say, I just need to speak to someone. We can get you in right now at either 9 or 5 o'clock, Monday to Friday. And then we also have shifts available on the weekends, and which crisis staff will assist with. It's over Zoom. It's obviously confidential. It's free. So anyone can call and just say, I need to speak to a clinician. You know, we have some clients that, you know, may just have an extra tough day and they can't get to see their clinician, so they utilize UBHC. That's another-
So Amanda, just quick question for you, because I know that Monday through Friday, they're calling the regular 508-228-2689 number to access the UBHC.
Mhm.
During the weekend, do they also call that same number, or do they call the number that you have for crisis, but self-identify that they're looking for UBHC?
That's a great question. So they could call during the week, the 508-228-2689. And even if you called after hours or on weekends, I actually get the phone calls. So someone will be available to help you. And then, or you can call the crisis number and just say you're interested in UBHC, and we can get you set up with an appointment.
Great. So there is access even on the weekends.
Yep.
Okay, thank you for that. Are there any services that Fairwinds is doing that are relatively new that you haven't talked about, that I haven't known to ask you about, that you'd like to update us on?
I mean, I think we were working really closely with the schools, and we have a school counseling program. So for kiddos that just need kind of short-term therapy, we can see them via Zoom for 6 sessions. And then if they need to be referred to us, we can see them ongoing. We have a collaboration with Our Island Home, where if they have a client that needs med management, we've streamlined the process so they can be referred by Our Island Home. We do a med intake for an hour, and then we do 2 follow-up appointments and make recommendations to the PCPs at the Our Island Home. We have ongoing collaborations with the hospital, which has really been exciting. We also are Fairwinds is providing 24-hour psych consultation to the emergency room providers and to the Fairwinds crisis clinicians 24/7. So there's someone they can reach out to and ask for like support around med management.
So that would look like if the ER had an ER doc on, and they were having somebody in with mental health, and they were thinking about medications, they could reach out to one of your 5 psych providers, whoever's probably on call, and get consultation around what kind of meds. Okay, very good. That's great. One clarifying question. Oh, Tara, I've got one more question, but you go ahead first.
Okay, just a quick, in terms of the school counseling program, do you also have a program or can work with kids who have, stress-related eating disorders or eating disorders in general? Or is that not really part of?
No. We have a fair amount of clients that are struggling with eating disorders, and our clinicians are all trained in what's called the Unified Protocol, which is a combination of CBT and DBT. Offer training through the Renfrew Center, which specializes in eating disorders. So yes, we can take care of clients struggling with that. We also have staff attending a training next week, and our psychiatry team is attending it on postpartum. We have a training center affiliated with Fairwinds that we kind of got funding through the Community Foundation. And so we offer evidence-based trainings to clinicians, both at the hospital, in the community, at the agency, where they can get training and then get being certified in certain things.
So that's great. Thank you. Good question, Tara. And I want to dovetail on that and say, just for clarity, because when you were talking about working with the schools and youth, did I hear you can see a student for 6 sessions before they actually do any kind of intake with Fairwinds? Because that's a big change.
That's a big change. I mean, the school has funding where they're able to refer clients to us for 6 sessions. And we've streamlined it. So basically they give us they fill out a referral form, and then they send it to us, and then we do 6 sessions with the client, obviously touch base with the parents and whoever else we need to. And then it's determined after the 6 sessions, do they need ongoing therapy? Then we get them into ongoing therapy, or are they okay for now? Or they might need another 6 sessions. So the school kind of determines like who the children are,
Right,
and what school they're focusing on.
So it sounds like minimal paperwork for parents and student to get that initial short-term work.
But again,
Right.
the referrals are from the school, so, we'd have to reach out to the school to get a better idea of, how they determine who's appropriate for that program.
Sure, sure. Tara, you had another question.
Yeah, just a follow up. In terms of the kids, in terms of students, if they're over 18, if they're 18 or over, how are you handling parental notification, or there is no parental notification because of HIPAA, or how does that work?
So that's a great question. So in terms of, once a child turns 18, then we will meet with that adult and go over and do new releases of information. So our goal is really to have them, hopefully sign a release of information for their parent or whoever their contact is. Otherwise, what we ask is to get an emergency contact number. So if we were ever concerned about someone's well-being, we have a number that we can at least reach out to say, hey, so-and-so didn't come to their reception, can you let us know how they are?
Okay, thank
That
you.
is, yeah, so that's something we're very cautious about, because once they're 18, they're independent, they can make their own decisions.
Does anybody else have any other questions for Amanda or clarifications? Suzanne?
Yes, I didn't know what UBHC stood for.
So it's called Urgent Behavioral Health Clinic.
Oh, okay.
Basically a same-day appointment, and it's free. And just as a reminder, Fairwinds sees anyone regardless of their ability to pay. That's the wonderful thing about our agency. We slide down to zero. If people are struggling, they don't have insurance, or they can't pay their copays, we will still see them for services.
And that's this new service that you were talking about, all the different things.
For all of our
Y-
services.
Yeah, okay. UBH.
Yeah, I mean, obviously, insurance covers some services and then they don't cover others. So even for a service like peer recovery coaching, which is for teens and adults with substance issues, where you have someone with lived experience who can work with that individual in the community as a support, we can provide that for free if their insurance doesn't cover it.
Right. And so you are billing insurance, but that certainly doesn't cover a huge scope of what you offer for services. So it's covered through a multitude of other ways, donations, fundraising, and
Grant.
and the second shop.
Yeah.
Right.
So,
So give to the second shop, shop at the second shop. Thank you very much. And do you feel like you covered everything you needed to?
yeah, I think, and the only other thing to remind people is we have the in-home therapy program where we have clinicians and therapeutic mentors who are paraclinicians who are able to go to the client's home and work with the identified child, but also their siblings and their parents. It's kind of more like a family therapy. And these are for kids that are at risk of being out of school, out of home, that may be struggling with mental health issues, behavior issues. And so actually, the clinician can go in and work with them there, which is another great resource.
And out of curiosity, is there still case management being provided on Nantucket for those children? I know it has not historically been through Fairwinds.
I think there is some case management, but it's not through Fairwinds. I mean, I think that's something that I have experience with in the past, and I think would something that we could do better at as an agency and just the community overall. And I think Family Resource Center is another great resource to help with case management.
Great, great. Thank you so much, Amanda, for all that good information. Did I leave any question that you guys had unanswered about all of Fairwind's new services?
No, but thank you, Amanda.
Thank you all.
Okay, moving right along to Veronica, I believe it is, for contract review committee update and youth behavioral health grant.
Okay, last month I went through the grant applications that have been awarded from the town through our taxes allocates in their budget $650,000 for not-for-profits. And of the applications we got, the applications were for 850,000. We had to basically make some tough decisions, but we have made recommendations to the town, and those $650,000 will be voted on at the annual town meeting. It's in Article number 9, which I happen to have right in front of me here. So it's $650,000 that comes out of our budget for next year that's been allocated. Additionally, there was $175,000 that comes from a portion of the tax taken in on cannabis sales on the island. And we went through the second cycle of grants for alcohol and substance abuse programs. That is also incorporated in Article number 9. So it's a total of $825,000 that is in the town budget for next year, but it does get voted on at annual town meeting as part of our overall budget. So when we finished doing this cycle, there was a lot of attention that was brought to the public with, started with some letters to the editor and on our various digital publications that brought to light, it seems to be a strong need for youth behavioral health services. So the contract review committee, even though we were out of cycle that we just finished this, we recognized that, yes, some children are being served with this, but it's a different focus we wanted to do. So we prepared a request to finance committee. And what happened is we recognized we were potentially out of cycle, and there potentially could be money for this year, but it was requested that maybe we wait until November when there'll be a second annual town meeting. And maybe it would be a better idea of how much money would be available. But then it went to select board, and select board heard our request, and it was unanimously said that this is something that we need to pursue right now. So the stage that we are at, we have been meeting with different organizations in the island, because what we're talking about here is, we recognize that there is programming happening on the island, and there's fantastic things that are happening on the island, but we think that there has to be more. And, we're basically, as we have just talked amongst contract review and with anyone we've met with, is children, if they don't feel that they find a place where they belong or something that makes them feel happy, there's a potential that they will seek, things that will fill that void. And so we hope that through the efforts that will be a collaborative effort with organizations throughout the island, we are going to maybe have less clients for the adult services on our island. So, everyone says, well, what kind of things are we talking about? We have met with a volunteer grant writer that has been fantastic in helping us to develop a vision. And from that, we will be producing a request for information, probably happening within the next week, that will go out to anyone and everyone. The annual town meeting is in 2 weeks, and we are not ready with RFPs for annual town meeting, but I think what we'll be able to do is when we go, we will have a good idea of the potential of the involvement that we could have. And if we are granted monies for this project, we will then kick into high gear, that hopefully we could have some programs going in the summertime and in the next school year. So that's where we stand right now. Questions? And Jericho, please feel free to add if I've forgotten anything, because it's been a pretty, it's been an interesting process, to say the least. Sue?
Kathleen, you're on mute.
My computer just told me as well. Sue?
So I've been following a lot of the meetings, and Veronica, one thing that think I missed, and it probably happened while you were deliberating the last set of grants, is what I've heard several ideas about, you know, mentorships and certain kinds of problems or certain kinds of solutions, but other than the newspaper articles about, you know, the vandalism in the schools, was anyone able to identify like the root cause of problems that the youth were experiencing?
Well, first of all, we're talking with this grant that we're proposing. It's for age 0 to 25. So we're talking really up to young adulthood. So not just schools. And we know, and I think everyone is well aware, that social and emotional development for our children, COVID suppressed that development, and everything I've read, it's potentially up to 2 years. So we're talking about education, intervention, and prevention. We're not talking of any treatment programs here, but exactly. I don't think I have a strong answer for what you're just you know, for your question. But that's basically what we're looking at this point.
Gotcha.
Thank you, Veronica. Any other questions for Veronica? No?
Jericho's hand is
I
up.
Yep,
did wanna-
Jericho.
Sorry, I did want to add on a couple of parameters that we're pretty sure are going to be part of it. Is that there are 2 potential paths to the funds being released. The first is that the amended article at first town meeting goes through, and then that money would be released July 1st with the turnover of the new fiscal year for the town. The other possibility is if that does not pass, the additional funding does not pass, the existing CRC funds should be separate from this. But if the
Yeah.
additional funding does not pass, it will then go to the special town meeting in the fall, which would be, let's just call it suboptimal, because that would delay us getting programming out. We wouldn't have as much lead time ahead of it. And Sue, to your specific question about root causes, and I'm assuming sort of the extension from that would be some sort of parameter or metric by which to measure improvement as time goes forward. The idea here is that we would be doing a variety of different interventions into the youth behavioral health ecosystem, and using this as sort of seed money to see which programs have more buy-in, feedback, or success. So this would be more of like a seed program where we're then trying to get successful programs from this, subjectively measured, of course, connected to other grant funding, because this is only a single year grant.
Right.
We only ask for a single year. Part of what our rationing for the out of sequence is that we can use this effort to connect existing programs with other funding sources, ideally through partnerships with other nonprofits.
Right. And that's an extremely important part of this, that we know that if we are granted additional monies for this effort, whatever we are preparing, we're preparing it in looking forward down the road for year 2, 3, 4, and 5 that could come from off island or private donors, foundations, etc. And we will not go back to the town again in 2025 and ask for the same thing. So we're looking at developing long-term, because we realize whatever happens can't just be a 1 year, it has to be multi-year. But and that's why we've through some generosity have gotten some volunteer grant writing who has had some pretty good track records on seeking other monies. So,
Thank you, Veronica. Okay, I'm just checking for any other questions and then we'll move on to the next agenda item. Okay, moving on. So updates from the Human Service Director. So Jericho, you're on deck.
Okay, so I don't have much to report on the COVID infection rate side of things. That's been about as flat as it has been since I've been with the town. So in terms of current state of infections, we're in very good shape. Wastewater tests have been flat, or literally have been statistical noise at this point, around 0 or very close to it. There has been a recent change in a couple of levels of vaccination issues. The existing original vaccine, which is now being called monovalent, that was the initial series that basically all of you guys got, has been pulled from administration because it is out of date and there's no reason to administer it at this point. All of the existing variants basically treat it as no barrier to infection, although there definitely still is some hospitalization and death protection that comes through. As a result, all doses that are going out in Massachusetts, all doses that have gone out since last fall were bivalent. Up until Veronica actually referred me to this, up until I believe today or yesterday, there were no guidelines around anyone who has already had at least one of the bivalent boosters. So if you got vaccinated last fall, up until yesterday, you were as vaccinated as you were supposed to be. The FDA released approval for a 6th shot, or more likely, more accurately, a second bivalent booster. As a result, that second bivalent booster will probably begin to be administered, if previous history is any indication, next week, which ironically is a couple days after the next scheduled vaccine clinic we have this Saturday. So if you currently have one or more booster doses, and one of those was bivalent, you will be eligible for a new vaccination as soon as the state of Massachusetts gets its data, like the administration software, updated to handle it. There is a small chance that will be before Saturday with the clinic is scheduled, but I consider it a low likelihood. Next available vaccination will be in a month in May, and then we have one more scheduled in April. The exact date and confirmation of those we'll have to wait until after this upcoming clinic. Otherwise, things that I'm working on, the Nantucket Behavioral
Can I
Health
pause
Initiative.
you on COVID
Of
for a
course, yeah,
second
yeah,
before
sorry.
you move on, please?
Apologies, please
Tara,
go
did
ahead.
you have a question?
I think Veronica was first.
Oh, I
Okay.
didn't see.
No worries.
Just to clarify, I think what was released, and I don't know if you said this, Jericho, I may have just zoned out, but it's for 65 and plus, and anyone with the conditions that would allow you, because you're immunocompromised. But the FDA and CDC said they will be reviewing potentially in June, offering the second bivalent to others, but right now it's 65 and plus and immunocompromised.
Thank you. Tara.
And so just to clarify too, the initial boosters were all bivalent, right? Or were they not?
If you had a booster shot in Massachusetts or most of the other New England, like New England or Northeast states, and you had that after about September of last year, you have a bivalent booster.
So it's after September. Okay.
Almost certainly everyone who has gotten a dose of vaccine in the fall of last year received a bivalent vaccine.
Thank you.
And Suzanne.
I have a question. Is this what we're hearing about, like on NPR News, is called Omicron
So yeah, the
variant?
as of about last fall, technically the bivalent COVID is designed against wild type, which is like the heirloom original form of COVID, and the Delta strain, which was another immune breaking variant that gave us a nice outbreak. And I believe that was the summer of 21. The bivalent COVID is designed for both Delta and the earlier Omicron variants. So yeah, this protects you against, this is where you start to get into Omicron BA2.C.A lineages, et cetera, et cetera. But as of right now, it is likely that they will be moving. So long term, this is going to be a seasonal vaccination process, much like the flu vaccine. And they will use what strains are current in the southern hemisphere during the high transmission seasons to build a new variant for the northern hemisphere when it's wintertime there, and vice versa. It's likely that there will be a new formulation put together in the fall. And I think that's one of the reasons why they're hesitating about going wide on the bivalent COVID, because there'll be tri and quadrivalent variants coming, or vaccines coming out relatively soon. So unless you're particularly high risk, either through age or through some sort of immunodeficiency, you are not currently recommended to get it, because likely the extra protection is not going to be worth it when there's a more specific vaccine that comes out in the fall.
Great.
Were there any other COVID related questions? No? Okay, so other stuff that I've been working on, we've been getting a lot of programming together at the Salt Marsh. There's NCEA, that's the Nantucket Council of Elder Affairs, which is the 501c associated with Salt Marsh, has been increasing its senior focused activities. There's exercise, movies, a variety of social events. Additionally, the Nantucket Behavioral Health Initiative, specifically the Continuum of Care subgroup, is working to match current resources with gaps that were identified in a behavioral health study that was done a few years ago by GPS. I think several people on this call were involved in that study as well. The organization behind NBHI is going to be incorporating as a 501c, and we'll be doing press releases and doing some more online presence. And then there's going to be some branding initiatives that go along, primarily just in the outreach and communication area. And then I believe that they're planning on staffing that organization up in the next couple of years. In the next couple of months, not years. After that, we are getting our needle remediator sorted out at the health department. We're doing some processing for sharps disposal for the fire department. We're going to try and move that into a partnership with a variety of nonprofits on the island to try and defer or reduce costs that they may face about sharps disposal. There is a large update to the town's directory of all human services coming in the area. It's called Network of Care. I will be bringing the demo and prototypes from that to this organization and to a couple of others for some beta testing. The contractor there, Trilogy, is going to be beta testing a new front end page, and then we're going to be trying to get a sort of single stop for all human services related resources, and then really kind of build out a dashboard or a more interactive or feature rich landing page, and then promote the heck out of that. After that, what else have I been working on? There is the ongoing work at determining cannabis impact costs for the town in an attempt to keep up with new regulations that were just released about recreational and medical cannabis use. There is a new, we actually just hired a new community health nurse. She will be starting in May and stepping into Heather's very capable shoes. And then we're going to be expanding the Ask a Nurse program, both at our house and at the Salt Marsh Senior Center, with an eye to finding other places to meet people to deliver basic health needs. I think that's the majority of it. If anyone has a question on anything I just brought up, that's awesome. And if they have any outstanding questions about what the heck the town is doing about X, Y, or Z, email or ask me now.
Anyone? No, it looks like we can move on to the next agenda item, which is other business. And I know one of the things that we discussed, Veronica and Jericho and myself, is you'll notice that Jennifer is not on the on the call today. She ended up having a conflict. So I think we were going to talk about making our meeting not on the third Thursday, but maybe another Thursday of the month so that she can attend. Does anybody else have a conflict on any other Thursdays in the month that we
Sue,
should be aware of?
Sue, I remember at one point you had a Thursday conflict.
Yeah, on this schedule, I had a conflict in maybe August. I have a Thursday meeting that is not on a first, second. It's like every 6 to 7 weeks, so there may be an occasional Thursday. but
Okay.
I can work around that.
It will, and I suppose I'll throw this into the discussion as well, since you brought up August. Last year, we looked at the busiest months in the summer, August being one of those, and wanted to have a discussion about should we potentially not have meetings in July and August? Start back in September, which I think is what we chose affirmatively to do last year, but just wanted to put that out there as well. So we need to make those two decisions. Tara?
I mean, I would say that maybe we also just add a provision if we do not meet in July or August, that we can instate, sort of a as needed emergency, meeting in the event that something extremely important or comes up.
The only restrictions on how quickly we can go from, hey, we should have a meeting to having a meeting is 48 hours.
48 hours, right? Yeah,
That's it.
yeah.
I think it might also be helpful if we do, we maybe do an additional meeting in September or something, because depending upon when the CRC process starts up again for the next fiscal year, it might be a good idea to have a start of process update for CHS and then an end of process update for CHS as well. If we can't fit that into the single meeting that we have in September.
I wonder how people feel about an extended one meeting versus 2 meetings in September. So in other words, instead of an hour, we extend the time of the meeting, but do 1 meeting. Any thoughts on that?
I'm all for that.
I'm all for that. And
Everybody, great.
And Ethel, I normally have a conflict the
That's
4th
fine.
Thursday of the month.
4th Thursday? Anybody else?
So tentatively first or second Thursday.
So I think, what do people feel about, if you're good with the second Thursday, put your thumbs up. Awesome.
First would be
Oh, that's
better. for me.
the first
is-
one would be better for you?
It's better for me, but
Anybody have a problem with the first Thursday? Put your thumbs up if you're good with it. Okay, looks like first Thursday is all good. Jericho, for town purposes and your purposes, are there any issues with first Thursday?
Not for me, no. As long as we're doing it after 4, then it's very infrequently will there be a conflict.
And we've also kept it at 4 o'clock, thinking that when we have people who are working come to the meeting, that it's within their work hours. Again, with thumbs up, has this been okay for everybody?
If it did go later, it would then bump into other conflicts I have.
Okay, we're trying to keep it, there might be that one that we do
Yeah.
special, that
Yeah.
we should let you know ahead of time.
Yeah, it's fine.
Okay, that is great. I have to ask the question to Jericho. Do we have to vote on any of that?
I do not believe so. You are not committed to these schedules. The point where you're committed is once it's posted, and then it can still be canceled up to
Great.
the moment before a meeting.
Just wanted to make sure I was doing my job. So that would free up Jennifer to make it to the meeting. So Jericho, can you send out that announcement in an email to everybody, including Jennifer, letting her know that we've
Yes.
changed it so that she has the ability to attend? Great, that's awesome. Any other business that anybody has? Veronica?
Will we meet on May 4th or will we do this June 1st? because May 4th, I potentially would have just on that day a conflict.
And June 1st, I have conflict.
Okay.
I'm just looking at the calendar. Hold on. So May 4th, you have a conflict. Is it a time conflict or is it a whole day conflict?
I'm in a meeting probably until 5 that day. In fact, Sue, Vincent, and you will also be in a meeting that day. We
Oh,
have a,
that's CRC.
And I also will be in.
and
that.
also, yes,
So, if we went to June, Veronica, could you cover for me?
yes, I could.
Okay, so why don't we, Jericho, are you okay scheduling it June 1st? And that means we are missing May.
Or would we still hold May, but then,
On the, go ahead and hold May on the, well, it's very close.
Yeah, I feel like that's
Let
a
me
long-
just-
time?
Okay, so Veronica, you just won't be there on the 4th, but I can be there May 4th, which
Jericho-
is so close.
Jer- Sue and I will not be there. Jericho,
Oh, that's a lot.
And
Yeah,
it's,
I was
Yeah.
suggesting that maybe we.
Another
stick-
date.
That we,
we-
yeah, then we do a different date in May and then do the June one, maybe even if, was it? I don't know, remember, Sue, is it you that had a conflict on the second
But I
Thursday?
could do it this second Thursday.
Oh, okay, so what if we do May
The
11th
11th?
and then do June 1?
I could do that.
And can I suggest that we do a half hour May 11th since it's so close?
okay.
let me just restate this in a way that will be, prevent me from doing the wrong date and time. So we are looking at, we're looking at, right now we're looking at May, which day?
11th
So we're gonna do
11th.
May 11th at 4 PM.
for half an hour.
Okay.
And then we're looking at June 1st.
I think, I think we can, I'm not gonna post the.
You
June
wanna
one until-
revisit that?
Yeah.
Okay,
Not to change the date, just because they're getting annoyed with me down at the organizing thing for reserving a ton of meetings ahead of time, so.
okay. But for the sake of everybody's knowledge here, we're planning on June 1st at 4 o'clock.
Okay.
And Veronica will chair the meeting that day.
Or getting annoyed for you for being on top of things? That seems silly.
Thus is government always interesting.
Yes.
Any other business?
I
Um,
have,
Veronica, then Sue.
okay, who would we want to invite for next meeting? Because we've been talking about inviting different organizations, et cetera. I have a suggestion, not for the May, but maybe for the June meeting. Since we have some new management at the food pantry, I would like to invite Ruth Pitts and crew to do a presentation, because by that time she'll have some time under her belt and could give us some updates.
Sue?
I have a possible suggestion for the May meeting. And she might be able to consent right now, is if Tracy would like to speak from the Nantucket Resource Partners.
Say that again, the Nantucket Resource
Partners?
Partners.
The partners or partnership?
Partnership.
Partnership. Pardon
Would
me.
you like to do that, Tracy?
I would love to do that.
Great. So we'll put you on the agenda for the 11th.
Great, thank you.
Yeah, I was just typing that to Tracy as Sue brought it up. So I was like, oh, okay, good, great
Like
minds.
psychic connection, Jericho.
Great. So we will put you on the agenda for then. Any other ideas for June? No, everybody good with the, inviting the food pantry? That seems,
Hmm.
One thing I would say, just, I
Yep.
wonder if there is, if there's any organization that maybe, I can't think of just off the top of my head, that gets a huge ramp up or a huge change in terms of services over the summer with, if maybe there's an opportunity there to meet with one of those organizations, but the
I know
food,
a safe place always does.
yeah,
As do the various nonprofit childcare organizations.
yeah, that's sort of what I was also thinking, is just some of those,
Oh, yeah, anyone running a summer camp.
or even also even, I mean, how is our house gonna be?
They are actually not running in the summertime.
That's what I was wondering. They're not running, right? So,
So-
okay,
As best I understand their model right now, they do have some financial burdens associated with the house. So during the summertime, it is configured as a rental property. And they convert it to and from at the beginning and the end of the year.
Ooh.
Yeah, that was one of the things that we're hoping to expand. Because there's a huge age category of people who are under engaged during the summertime, sort of when a lot of the risk factors are especially high.
Yeah.
At least for tomfoolishness.
I, by the way, may have someone who wants to make a significant donation, so I had been talking to them about their program, so I'll connect with you maybe offline.
Absolutely. That's a program that I am attached to, so I
Yeah.
would like that to work as well as possible.
Yeah.
So,
They also reached out to me to ask about doing a fundraising event during the summer for our house. So let's connect on that offline.
Please do.
great. Thank you, Tara. So does anybody have any feedback? We talked about a safe place or a food pantry, or potentially both if we think we have time in June. Amanda?
I was just thinking the Family Resource Center as well, but maybe that has to wait for the fall. And that would be Christie.
Great. Well, good. We've got some people for a lineup. I like that. What do you guys think of having 2 people on at a meeting? Do you think that's gonna be too much?
No,
No?
I mean, there's so many organizations that, and with the frequency of our meetings, it's probably appropriate to have more than one.
Okay, so I think maybe if everybody's okay with it, we can reach out to a safe place and the food pantry, since I do think since the food pantry has a new director, that makes sense to have her on, Ruth on, and discuss that. So we will look into that and see what kind of invitations we can make. All right, so did somebody have something that they wanted to add?
I had a question, if we're gonna have 2 people, is September's gonna be a longer meeting, we're thinking tentatively? And that would, give people more time to present.
Okay, I'm okay with that. A lot of people seem to be nodding, so I think the most pressing, if I have my finger on the pulse for the summer, is a safe place.
Yeah, I
I
agree.
think so.
I
One
think
of-
the food pantry is not pressing, not as pressing because everybody's working
Mhm.
and money's coming in the door. More in the off season, the food pantry is definitely a huge resource. Sue.
One thing that just came up is that the food pantry is usually open on Thursday, late afternoon, so I don't know if they'll have.
Until 6 o'clock, but
Hmm.
if, we can talk to Ruth about that. Or we can get potentially Tom Dixon to come in, also.
And then
Or maybe she can give us a tour.
Right?
I'm kidding.
Site visit.
Suzanne, another thing
Yes.
potentially to think about for the fall or September might be getting the Athenaeum to give a presentation on a lot of the stuff they do. I keep hearing about stuff they do and I'd love to hear more.
Yeah, I was just thinking about that. We just had a staff meeting recently, and there's a lot of programs being offered at the library. And one is a youth on Wednesday nights. There's a couple of for the teenagers, like some kind of car racing thing. I forget what it's called. And then they have game night, and it's becoming more and more popular. And last
Right.
night, I teach a class there on Wednesday night, astrology class, and I had to, wait to help shut down the library, and it was hard getting the teenagers to leave.
That's great news.
Great.
Yeah.
I know.
Okay, I'm aware that we've gone 6 minutes over and I do try to keep us to our times. So would anybody like to make an emotion to adjourn?
I'll make that motion.
Thank you, Sue. Would anybody like to second?
I second it.
Thank you, Suzanne. Are you stopping recording?
Oh, sorry. Let me do that.
Do we have to do a?
Oh, we
roll
have to do a
call?
roll call.
sorry.
Yes, I always forget that. That's why you didn't do it.
Wait, didn't we also have to close the meeting from last
Yes.
That's right.
Yes.
month?
Yes.
We
So
have
you
to-
need-
because
I
we're
need two
we're still-
motions to adjourn.
Two motions to adjourn,
I
one
make
last
a-
meeting.
I make a motion to adjourn the March meeting.
Yay.
I'll second it.
Very
Right.
good. And so now we're gonna do, we have to do roll count vote on all of
Twice.
them, or can I
Yes.
just say?
Yeah, I think we will.
Yes,
You have to do both.
okay,
Yeah.
separately. So I'm gonna do roll call vote to close the March meeting. Tara,
Hi.
Suzanne.
I wasn't at it. Can I vote anyway?
You may.
Oh, okay.
Oh, okay. It was closed for me.
Sue,
Aye.
Veronica,
Aye.
aye. And roll up, Amanda.
Aye.
Great. So that's unanimous. The March meeting is now closed.
Yes.
Now we will do roll call I can't even speak anymore. Vote to close this meeting. Tara,
Hi.
Suzanne,
Aye.
Amanda,
Aye.
Sue,
Aye.
Veronica,
Aye.
and I. It is closed. Tracy, thanks for coming.
Thank you, Tracy.
Thanks for having me and letting me listen. So this is great.
Very good. Bye, everybody, and thanks for having so many people. It's good to see everybody.
Yeah.
Yes.
Bye.
Bye,
Bye.
everyone.
Aye.
Pressing the button now.